metrics or things you would look for if you were trying to choose a treatment center for a loved one or for yourself. And this is no easy task. As you know, we've discussed before the lack of regulation in North America has made this a particularly burdensome task for anybody who's trying to, kind of sift through them and find ones that are, you've got ones that are on one side that are complete scam, money laundering, or just there to fleece people. And then you've got older institutional kind of facilities like, what's that one? Betty Ford. Ones that have maybe are standing on a reputation of longevity, but when you look closer, it's kind of the same old thing. They're still not effectively tracking metrics, and so it's a difficult task. There are facilities that I feel are perhaps better for some folks than others, and I think it's very much dependent on your circumstances. But we can go over some of the basic things that people look for and discuss them kind of as they pertain to us personally, and that's about as good as we can do because everyone is going to have their own kind of needs. So
yeah. And of course, should be prefaced by saying if you have a choice, because there are many people within our community who didn't have a choice at all, and it was imposed upon them. And then, of course, there are those who are eliminated by virtue of how cost prohibitive these facilities can be. So, if you had choice, if you had time to research, if you had money, we're sort of saying if those things are in place.
Yeah,
right?
that's a great point. Yeah, before we jump right in here, assuming that everybody's got the resources to actually pick one of these facilities. In Canada, there's a stream that's supported by our normal healthcare system, and then there's a kind of a private tier, and there's some overlap between. But the first thing we wanted to look at, and I felt was I feel it's important, is staffing. So I guess we'll also say that, I mean, I've only been to one facility in Canada, and I'd never going back to another one, regardless of what happens. And that is Homewood in Guelph, and it was an inpatient treatment center, and the duration was 35 days. And you, Corey, you were involved with an outpatient facility. And I think you kind of seem to have a better experience than I did.
Yeah, definitely.
So,
and then my only other experience would be that when I was in nursing school, I did a little bit at a very old facility in the Fraser Valley.
Okay. So just to get another look at how maybe some other places are run.
Yeah.
I mean, I've investigated facilities for clients, and I've looked at, I keep an eye on, especially the facilities that are healthcare professional stream facilities, just to, because it's with Obsidian, people always have questions about, where am I going? What's going to happen to me? Blah, blah, blah. Of course, these type of things. So try to keep an eye on that. But one thing is the staffing levels and the credentialed staff that are available. So that means, do they have a medical doctor on staff? Lots will say that they do, but maybe the doctor's only there for a day or two, and it's very difficult to get an appointment because the group sizes are so big. Other ones, you'll be able to get an appointment, but it'll be maybe a general practitioner who's just kind of cycling in and out. So there's a difference there where bigger facilities will have an actual doctor on staff who's familiar with addiction medicine. And if you go to some of the biggest centers in Canada anyway, they'll have a psychiatrist available there for diagnosing comorbid conditions, which I think is significant. That can be a big deal for people because, as we know, addiction is often linked to other mental health challenges. And then whether or not they have a accredited psychologist is important. And the other thing that places like to advertise, or at least if they'll advertise it if their numbers are good, is the ratio of counselors to patients per group size. I don't know how important that is. What do you think about that one, Corey? And we're talking about these are the addiction counselors who they have a bit of training, but most of them tend to be people who've been through a program, so they have lived experience, and then they want to, kind of give back or stay involved with the program somehow, or they believe in the program enough to be a part of it, that kind of thing.
Yeah. And what do I think about that? I think it really depends. It really depends on those individuals, and if in doing your research, you will likely not have access to like what the training of the staff is. But I think it probably greatly depends on that. And it also depends on what the model, and we'll get into this, like, is it a facility that leans heavily on the 12-step model? So the counselors are just there to kind of help you navigate the 12 steps, or are they there? Do they have maybe they're a university student who's interested in going into counseling or going into something within that profession, so they've already got some maybe a little bit of training in communication, therapeutic communication, and they're just maybe a little bit more diversely educated, I'll say.
Yeah, open-minded, versatile in their approach.